My name is Darcy Reed. I'm an assistant professor of medicine at Mayo Clinic in Rochester, Minnesota. I'm a consultant in the Division of Primary Care Internal Medicine in the Department of Medicine, and I am the senior author of the article Duty Hour Recommendations with Implications for Meeting the ACGME Core Competencies, Views of Program Directors. And this article is to be appearing in the March 2011 issue of the Mayo Clinic Proceedings and will be online first in mid-February 2011. I think a little bit of history would help put the main findings of the study in context. Duty hour regulation can be traced back to a tragic case of death of a woman named Libby Zion in a New York hospital. That death was thought to be attributed, at least in part, to fatigue and lack of supervision on part of resident physicians taking care of her. And that led to legislation in New York State regulating resident physicians' duty hours and limiting their work hours to 80 hours per week. Then in 2003, the Accreditation Council for Graduate Medical Education, which is the body that accredits all residencies and fellowships in the United States, the ACGME issued duty hour regulations in 2003 that limited residents' duty hours to 80 hours per week, in addition to some other limitations. And then approximately 5 years after those recommendations, when we had some experience with that, the Institute of Medicine took a look at the literature examining the 2003 duty hour limitations, as well as hearing testimony from stakeholders about the issue, and then released an important report on sleep and fatigue and supervision among residents. And that report was released in December 2008 and called for additional restrictions in residents' duty hours. And so the Accreditation Council for Graduate Medical Education considered this report and reviewed the evidence, and they have now released new duty hour recommendations in 2010, and their recommendations include limiting interns' work hours to 16 hours in a shift. Interns are physicians who are in their first year of graduate residency training after medical school, and as well as increasing the standards for supervision of residents. We chose to survey program directors because the program directors are the individuals who are responsible for implementing the duty hour recommendations, and they are the ones who are most familiar with the educational needs of the residents and really what it takes to train a competent generation of future physicians. So we surveyed program directors in the United States who are directors of internal medicine, surgery, and pediatrics programs. And we asked them to share with us their perspectives on these new duty hour recommendations. And what we found is that there is some concern among program directors about the implications of the new duty hour requirements on the development of competency among physicians, particularly in the area of continuity of care, of communication, and professionalism, and patient care generally. And surgery program directors felt particularly concerned relative to internists and pediatricians. I think the core of the issue for patients is what is it that we need to do in terms of working within these recommendations to achieve the very best outcomes for patients. Everyone, program directors, residents, patients, everyone in healthcare wants the same thing, and that is the very best outcomes for patients. And so the challenge is how to develop systems of care and educational programs that will train the most competent, excellent future physicians while working within the duty hour recommendations. And I still add that the spirit of the duty hour limitations are to decrease fatigue among residents, so that residents, when they are taking care of patients, can be working at their optimal performance. Yes. So I think the next questions to ask following this survey really are how do we design systems of care and educational programs that will allow us to achieve the very best outcomes for patients while also achieving the highest level educational outcomes. And some of the specific areas that are an important target for research are in transfers of care, particularly the times when physicians are needing to hand off patient care to a colleague so that they can leave the hospital and rest. before returning to take care of patients. And that particular time, that handoff or that transfer of care, is an important target for research. I think another area that we need to learn more about is how much does experience mitigate the effects of fatigue on medical errors, and trying to understand, as a physician becomes more experienced, what are his or her needs with regard to rest and work hours in terms of their ability to provide safe and effective care. So the takeaway message from this survey is that program directors have some concerns about implementing the new duty hour recommendations, but I think it's also important to remember that any change comes with concern, and it's clear that the program directors have the best interest of patients and residents at heart, and are invested in trying to figure out the best ways to optimally deliver education and patient care, while also limiting the amount of time that residents are working so that they can achieve sleep and rest and be refreshed for taking care of patients.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.